this machine, it could detect very, very subtle motion, very, very subtle movements of isotopes much more accurately than a single lens Anger camera. And on this test here, this is before we chelated the patient, because we presented this to the ACAM folks back in the 90s when there was no language for this. And I was trying to explain to them that chelation therapy was not working the way they said it was working. It was working through a different mechanism. This is an analog wall motion. And you can see this heart here it's not beating, it's just wiggling. And in this here is what's called a regional ejection fraction performance image, where we can actually look at the region of the left ventricle and see what's working and what's not. So this is before this patient underwent chelation, and this is after. So you can see it's ejecting better and the wall motion's moving better. This is a second patient. We presented a series of 5 or 6 of these at the ACAM meeting, I believe in 92. This is the before test. This is the analog wall motion. And again, the regional ejection fraction performance is so bad, the heart's really not beating it's not ejecting any blood. And you can see here just the apex is moving. This is the after treatment. And again, after treatment, after chelation, you can see the analog wall motion and the regional ejection fraction performance is so high now, the camera couldn't pick it up. And we had a series of cases like this. But these cases kind of stuck in the back of my mind because they didn't make any sense if you framed them in the logic of conventional medical thinking, which in my world is actually an oxymoron.
In 1992, the following video clips were presented by Dr. David A. Edwards to the American College for Advancement in Medicine. These clips document how chelation works and chelation's effectiveness.
This is an actual cine-ventriculogram of a beating heart during exercise. The bottom diagram shows the analog ring motion of the wall. The top shows the regional performance of the isotope moving out of the ventricle during exercise. This is a study showing a resting heart on the top and the heart at maximum exercise on the bottom. Notice the posterior and anterior walls are not contracting. The apex only is contracting. After chelation, on the top image, notice the much more relaxation, the much more blushing in the ventricle, and the much more active wall motion on the stress test on the bottom. Here's another study before showing an analog ring and the ejection fraction performance on the top. This is heart failure. The heart is enlarged and not pumping well. The after study shows the heart is much smaller. Notice the much greater contraction of the analog ring on the bottom and the regional performance on top, where the blood is moving much more effectively now. Before chelation, we've superimposed both images, and after chelation, so you can see the results. Notice in the top ejection fraction performance the much greater movement of the pooled isotope in blood out of the heart as the heart shrank and came out of heart failure. Basically, what we're talking about here today is the difference between diabetes and metabolic syndrome. That difference exists by definition. Those are defined terms, like being a criminal or a Democrat or whatever. They're defined. They're not real. They're in the mind of collective medicine. Sometimes metabolic syndrome, it started out at Cornell with a doctor, a cardiologist, seeing a bunch of women in their 40s and 50s who had all the symptoms of heart disease. But when they looked at their macular vascular circulation, they didn't show any atherosclerosis or arteriosclerosis.